And if you made it here, it means you must have pushed on through some discomfort and reached out to some people. And in which case, you probably got some new patients booked in your schedule. And if that is the case, my friend, really congratulations, because that's a big deal. Now, this week, getting those patients into the door is hard, but it's only the beginning. Now, the real deal is how you actually hold space for them so that they do stay long enough for the magic to happen. And if you are thinking right now, but these people are coming for free and they're only coming because it's discounted, well, not really. They're actually giving your medicine a chance. They are giving you the most important commodity that they have, which is their time. Before we dig into this week's module, I want to share a personal story, another one. So many years ago, I started to have this really bad toothache, and I started to freak out with that because prior to that, I hadn't been to dentist for years. I was very broke and I just didn't go to the dentist. So when the toothache started to come, which was this one, it was really getting bad and I just kept on trying to ignore it. I was frightened of the potential pain that I will get, and I was also frightened of the cost it was gonna bring. So I kept on putting it off until I just couldn't put it off anymore. So I made a booking and I turned up at the dentist office. And when I arrived there in this really brightly lit dentist office, you know how cold it feels? Cold tile. I was standing there in his office, literally shaking. I was really surprised how shaken I was, how scared I was actually feeling. When the dentist came out and saw me, I suppose he could see how frightened I was. He put his hand on my shoulder and he said, "It's okay." And he met my gaze really gently and softly, and he said, "We'll take very good care of you. Don't you worry." Something really softened in that moment. I am on the dentist's dreaded chair and lying down. He took the x-ray, gently examined my teeth and probed here and there, and he got me up and he told me this. "Well, your pain is coming from A, and in order to deal with A, I see there's two potential routes. One is the soft approach, and second is a little bit more aggressive. The way I see it is that if I go and do A, B, C, I think we can actually address this. But if it doesn't temper down the pain, then we'll have to go to option B. But I think that we can actually do this." Well, how does this sound? I thought, how does this sound? It sounds bloody awesome. I felt so safe being told of this plan. What I actually got from this moment, in hindsight, is that this guy knows what the problem is and what to do about it. He's got plan A and he's got plan B. And he's got timeline how to execute this plan with me. I actually kept on thinking about this encounter for a while because I realized a lot of times I actually avoid talking about treatment plan to some of my patients. And I realized providing a treatment plan is actually a massive gift. In fact, it's actually part of the medicine. That's why I go to a dentist. I want him to tell me how he sees we can rectify this problem that I have in my mouth. So, coming back to my own reflection, why was I avoiding talking about treatment plan to some people? Well, my personal stories came up. this person cannot afford it. This person is not ready to invest in her health. This kind of made up stories that was coming in my head. I don't want this. I don't think that they will go with this plan. All sorts of made up stories that I realized that I had, and which is why I avoided giving the treatment plan to some of my patients. So this brings me to the core concept that I want to share with you today about patient retention. I've come to realize, and I also come to realize that I used to see it in a wrong way, that I used to think it was something like a sales thing, that I need to sell this to people. No. Patient retention and helping them to stay on a course is a medicine. That's what my patient is asking me to give them. With my integrity and my clinical assessment and their goal together, this is what I see, how I see we can actually get you there. This is a duty of ours, and this is part of the medicine. Think about it. Every medicine is dose dependent. Our medicine especially is a slow medicine. Most of our patients who's coming to see us suffer with chronic complex diseases. It takes years, decades sometimes to build to where they are, where they're actually just out of wit with their own health issues. And that's when they come to us. We need to be able to actually say, this is how we can help you with this kind of treatment program. And if you cannot do this, that you are under-servicing your patient and you are shortchanging them and their chance of getting better in the first place. Before I actually take you on the full initial consultation flow, what I call the winning initial flow, what I'm gonna get you to do is I'm gonna get you to actually reflect on the last 5 initial consultation that you've had. This is not about blame, but this is about assessing how well you're doing this very crucial part of your job, and if not, how you're going to do things differently so that the patient who's gonna come in tomorrow and this week, inside this week's workbook, you're going to find a worksheet that helps you assess how you're doing this currently with your patients. So get 5 last consultation history out and look at them each section, how you've done. Have I gotten treatment plan together? Did I communicate this clearly? If not, why didn't I? What went wrong if I did actually present the treatment plan? If it didn't actually land and your patient didn't book in with you or is coming back, what actually happened there? This week, we're going to make sure that this happens, that your patients are held properly in a treatment plan. To do that, what I want to make sure is that you assess your consultation process. Inside your workbook this week, you will find this worksheet that has these clear questions to help you process how you went with your consultation, last consultation. Bring about 5 initial consultations that you've had and go through those each questions one by one. Did I create a treatment plan clearly? Did I communicate that? Did that land properly? Did it eventuate into the booking? And if some of that didn't work, how am I gonna go and do things differently from the next patient? Now, let's get practical. Look, how do we build this confidence and communicate our treatment plan properly? Well, first of all, what we need to do is we need to have our initial consultation in order so that you don't waste your time in it and leave the booking and the important parts of delivering your treatment plan until the last. So here are the key things that I want you to remember. First question, what brings them here? Ask an open question and ask them, so what brings you here? And listen really openly about and listen really openly to what they have to share with you. And whatever words that they are using, I am just so sick and tired of this, for example. Use those words. Do not paraphrase their pain point into your own words. Number two, what would you like to do about this? Well, you don't have to ask this question like, what do you want to do about this? Of course. I put that question in such a blatant way because I don't want you to miss this. You want to ask very clearly, what is their goal? What's your patient's goal? If she came in with a shoulder pain, and as you start talking, you start to realize as a Chinese medicine practitioner how weak her spleen is. But you have to focus on the pain, okay? Do not get carried away with all the myriads of other things that you can see. Focus on their pain point and focus on what they would like to do about this thing that they brought into you. Again, jot down the words that they've used. I would love to just get rid of this thing. Or I want to manage this pain is two very different clinical outcomes that they are looking for, which should inform the kind of treatment plan that you compose together. Third part of your initial consultation, that you must come to your own diagnosis. You should communicate to your patient, this is what I see has caused this problem. Why is this happening? Why is your finger hurting like this? You've got to be able to explain to your patient how you see this problem has occurred. And when you're communicating your diagnosis, you really want to avoid speaking any of the jargons. You see, when you go to a mechanic, your mechanic telling you this, that, whatever, you want them to say to you in the terms that make sense in your head, because when they start to go into all this jargon, what's happening in your head? They want to complicate this problem and charge me loads of money. Well, that's what happens to my head. So you want to communicate to them very clearly how you see from your medicine's perspective this problem has occurred. And you want to communicate with them in the poetic, using metaphor rather than using all the jargons of Chinese medicine that doesn't land on them. In the workbook of this week, I have actually put down a whole arsenal of different metaphor for different Chinese medicine typical diagnosis, pattern differentiations, if you will. Qi stagnation, kidney insufficiency, empty fire, all of these kind of things. Use them, and I'm sure you can start to use your own language with that, but use that as a stepping stone to start telling what it is that you see in patient's body in a simplified way, as if you're speaking to a 6-year-old kid, okay, without being condescending. People don't need to know exactly what your diagnosis is, if it's heart fire or kidney insufficiency, empty fire. They don't need to know. What they need to know is that you know what's going on. Last part, one of the most important part of your initial consultation, I believe, is actually now the treatment plan communication. So if you can see how this problem has arisen in a very simplistic way, This is what I think. And once you have that, then this is how I see that we can untangle that and get you out of there. Let's say your patient is complaining about back pain and the knee pain. And you go, okay, the real problem of your knee pain is coming from your back. And you've explained to this patient about why this is happening, that accident that you had, that you didn't resolve this back problem very well, it twisted your spine a little, your legs are out of alignment, so this leg is getting more weight of your whole body, so it's getting the swelling. So this is what I see is happening. So in order for us to actually shift the swelling and to reduce the pain on your knee, what we need to do is actually we need to address your back pain first. That to happen, what I recommend is that we see each other twice a week for the next 3 weeks in order to shift that back pain quickly so that your knee will actually find the balance. And I do actually believe that once we rectify the balance of the back and release all the tension that your body is actually holding there, I think it will be kind of automatic that your knee swelling will go down. Consequently, the pain resolving itself. Once you actually say this, my friend, say it and leave it on the table. To not over-explain yourself, to not justify yourself. Again, all those are coming from, yes, your stories, your insecurities, and your fear, and your doubt. So leave whatever it is that you've said as a treatment plan. I would like to see you once a week. There's many different scripts on the workbook, so utilize them. I would like to see you twice a week for the next 3 months. What I recommend we do is that we meet once a week for the next 8 weeks to create enough holding for your body, A, B, C, D, E, like this. Say it and pause. Let them think about this and consider. You don't have to convince them, you don't have to push them, just leave it there. And you will find most of the times patients go, you know what, actually it does make sense. I kind of knew, dun dun dun. And they actually go, yeah, let's do that. If you can do this really according to your integrity, you're not doing this, you're not holding on to, you're not recommending 8 treatments to a patient. You think only need a couple of treatments. Don't do that. Don't do that. But if you do genuinely believe that this patient needs 8 treatments, 12 treatments, then you put it there and cultivate the mind, your mind that's open. My patient can now make the decision that is right for her. Finally, when your patient is on board, what I recommend you do is you book them in there and there. Don't leave it until you go outside to the reception area. Do it there. Don't also ask open-ended questions like, so when would you like to come back? That's just too broad. They need to think about too many different things. Ask questions so that they can answer yes or no. For example, so do you need to actually come off after hours? Can you do during the daytime? Ask specific questions like this so they can say, yes, oh, I really do. I can only come after work hours. No, but I need to come before 3 p.m. before I have to go and pick up my children. Something like this. Then it narrows down to the days that you're available and you say, well, I can do that on Thursday evenings. Does that work for you? Yes. Is that the only day? Oh, I've got Pilates, but yeah, you know what? I will change that. I will come. You say to them, that's the only evening that you have. So you narrowing it down, they making more commitment, they coming online with you, and then they go, boom, okay, Thursday evenings. Then you go, okay, I am going to book you in for the next 8 weeks, as we spoke about, in order to reserve that time slot for you. And if you need to change, cancel, for any reason whatsoever, all you need to do is you need to give us 24 hours notice. You don't have to give me why you're doing this or anything like this. I'm just booking you in order to reserve that time slot for you. Does that sound fair? Does that sound good? And then your patient will say, yeah, let's book that in. You see, you are contained, your patient is contained, she walks out, you do your payment, and boom, it's in their calendar. They don't have to think about it. 8 weeks, Thursday evening is their own rendezvous with themselves, with you in your consultation room. So here we are. It's actually quite a big module. How to do your consultation, how to communicate your diagnosis, how to communicate your treatment plan, how to do all of this is actually quite a big thing to learn. So take your time, and what I think it will be really, really useful for you is to actually go back to your past consultations and bring it in and look through with those questions that I gave you earlier on. Look through that lens of those questions. Did I have a treatment plan? If I did I say it? If I didn't, why didn't I? And you will find a very common story that's blocking you from doing your job. And when you do find those stories, you know what to do. In the week 1 module, there is that story processing worksheet A, B, C. Go and put those stories in through those worksheet again. What is the story? I don't think they will buy it. I don't think they will do what I tell them to do. Stories like this come up, I think that they're going to think that I am trying to be salesperson to them. It's too expensive for them. Whatever story comes up, go and examine it, and I am pretty sure that you will see that it's just assumptions, stories that your mind has made up, and that's what's getting in the way of your medicine. So go ahead, examine your stories, work through those questions, and utilize the worksheet, every part of it. Make it yours. And good luck with your new patients this week. And we'll meet you next week.